my name is Amber Goana and I would like to welcome you to my Med Talk. This is going to be some of the things I pulled from the CPJE California law exam, and as you can see, it's going to be basically like a little Naplex, and so each video is just going to go over each section that I kind of pulled little things from, and I hope you like it. So for this Med Talk, we're going to be talking about agents that have FDA approval indicated for smoking cessation. So first, we have nicotine replacement. So those are going to be, the first example here is gum. You have nicotine gum and lozenges. Okay, so there's different milligrams. You have a 4 milligram and a 2 milligram. The 4 milligram you want to use in patients who, when they wake up, their first cigarette is within 30 minutes after they wake up. The 2 milligram you can use if it's after 30 minutes they wake up, they want their first cigarette. Usually the max a day for the gum is about 24 pieces. For lozenge, it's about 20 recommended max a day. The recommended duration of use is 12 weeks. They are available OTC, so over the counter, they are available. It is actually approved to use them together. It's the most effective. Another nicotine replacement option is the patch. So for patients who smoke less than 10 cigarettes a day, the regimen you would want to use is 14 milligram patch on weeks 1 through 6. And then weeks 7 through 8, you're going to use the 7 milligram patch. Hoping by weeks 9 and 10, they're not even using a patch at all. If your patient is smoking greater than or equal to 10 cigarettes a day, you would want to use the 21 milligram patch weeks 1 through 6, the 14 milligram 7 and 8, and then the 7 milligram 9 and 10. Hoping that, after 10 weeks doing that titration down, they are no longer needing a patch at all. But the recommended duration of use for either patient greater than or equal to, 10, if they're less than 10, doesn't matter. The recommended duration is 10 weeks. They are available over the counter, and they are known to cause vivid dreams. So some patients kind of take them off at night because it could kind of, give them some weird dreams. You do it for non-adherent patients, so people who aren't very good at remembering to take their medications, which is actually a lot of people. So, they don't have to remember to take something every day. It's just something that's put on their skin, and, it helps with the cravings. These patches do need to be removed before an MRI. And you do not cut these patches. No cutting. The next nicotine replacement option is the inhaler. So weeks 1 through 12, the recommended max is 16 cartridges a day. Sometimes it's 6, it just depends on the patient. But, weeks 1 through 12, usually probably around 16 cartridges is going to be used a day. Weeks 13 through 18, maybe even up to week 24, you just want to kind of use a tapered down method on the patient. So depending on how many they use those first 12 weeks, you just want to kind of slowly get them down, until they're not having to use the cartridges at all. But the recommended max duration for the inhaler option is 6 months. After 6 months, they really hopefully should be not using this inhaler at all. You obviously would want to avoid in patients with COPD, asthma, because, their lung function is not going to be that great. It could cause, some more problems that we're just not really interested in. It is known to cause rhinitis. So if they also, have a problem with that, that's not very good to use. And it's really only good for 1 day after the cartridges is opened. So if they open it And then they're like, actually, you know what, I'm not gonna use it right now, and then tomorrow they come and they're like, oh, I already have this one open, let's just use that. Well, actually, it's not good anymore, so you're gonna have to throw that away. So the last option here for the nicotine replacement is the nasal spray. It's 1 to 2 sprays in each nostril every hour with a max of 5 doses in the hour, or 50 doses a day. So 2 sprays counts as 2 doses. And if you do that every hour, 2 sprays every hour, that's fine. You just can't be going, 5 sprays every hour. Don't want to do that. The recommended duration of use is a max of 3 months. You want to avoid in patients with, again, asthma, COPD, because, just their respiratory altogether is not that great. So spraying something in their nose is not happening. It's not very good. And also the rhinitis, just if they're having that as well, clearly you don't want to be spraying it in their nose. It can rapidly relieve withdrawal symptoms, but it has the highest potential for dependence because it can relieve that withdrawal symptoms so quick. General precautions with all of these nicotine replacement agents: you want to avoid in patients with arrhythmias, if they have angina, which is chest pain, if they have a myocardial infarction history, an MI, or they're pregnant. You don't really want to use these nicotine replacement options in those patients. General side effects for all of them is a headache, insomnia, nervousness, dizziness, and dyspepsia, which is heartburn, and obviously psychological dependence, because yes, you are trying to get rid of another not so great dependence they have, but it could also in turn have them dependent on these agents. So, it's just kind of something you need to be aware of when you're talking to your patient. So all of those nicotine replacements, their mechanism of action is literally, it's a nicotine. It's not in, like a cigarette where it has, different additives to it or whatnot. It's just pure nicotine. That's literally what the mechanism is. It's nicotine, and it's going to literally act just like nicotine from the cigarette. The next option we have here is a psychotropic. It works by inhibiting non-adrenergic and dopaminergic uptake, increasing their concentration, which is going to reduce the nicotine craving withdrawal symptoms. The only medication listed here that has FDA approval that is a psychotropic is bupropion. It's the SR version. It's also known as Zyban, is the brand name. The duration of use is a max of 6 months. You want to start the patient out on 150 milligrams a day for the first 3 days. And then they can take 150 milligrams twice a day after that, again for a max of 6 months. You want to start taking the medication 1 week before your quit date. So you need to set a date, and 1 week before that date, you want to start using this bupropion. Some general precautions you want to avoid in patients who are on MAOIs or have taken an MAOI within the last 14 days. Some examples of monoamine oxidase inhibitors are Nardil, Marplan, Parnate, and MSAM. You also want to avoid using in patients who are also on linezolid, IV methylene blue, or have a past medical history of some sort of eating disorder. It could be anorexia, or they're an alcoholic. If they're also taking benzodiazepines, you don't want to be taking those together, or barbiturates, definitely no. It's not recommended to strictly avoid in patients with hypertension, but they definitely caution that use in patients that do have hypertension. Some general side effects are insomnia, so you won't really, some people don't really sleep very well when they take this. You can get a dry mouth, you have tremors, tachycardia, so your heart rate could increase. You can get some blurry vision, dizziness, headache, constipation. And the last FDA example of class I have is partial nicotine receptor agonists. So these work by partially stimulating the alpha-4 beta-2 acetylcholine receptors, which is going to cause a lower dopamine level to be released, and it's going to reduce withdrawal symptoms. These also kind of block nicotine itself from binding to where it would usually bind. So the option here is Chantix. Versincline is, the generic Chantix is the brand name. On days 1 through 3, their dose is going to be 0.5 milligrams once daily. On days 4 through 7, you're going to be doing 0.5 milligrams twice a day. On day 8, until you quit smoking altogether, it's going to be 1 milligram twice a day. And that's really only if their creatinine clearance is greater than 30 milliliters per minute. But if the patient is less than 30 milliliters per minute, they could do 0.5 milligrams daily. They could just keep doing the 0.5 milligrams daily, or technically they did show some studies where they could do 0.5 milligrams twice a day. For most patients, the usual duration of treatment is 12 weeks. There are some patients that they've done some studies in that they did for 6 months, but usually 12 weeks. And you want to start the patient on the medication 1 week before the quit date. You want to aim for their smoking cravings to be decreased by 50% in the first 4 weeks. And they need to be totally smoke-free by week 12. That's the goal with this medication. You do not want them to also be on other smoking cessation agents. So you don't want them to add a gum or a lozenge or a patch or an inhaler or the nasal spray. You don't want any of that. Also, definitely don't want to be taking it with the bupropion. So if this is not really working out in those first 4 weeks, if you don't see that 50% decrease in the patient, you really need to just try something else. It's just not really, benefiting the patient all that much. It is not recommended for the patient to be less than 16 years old either. So don't use with other smoking cessation agents. Do not use it if the patient is less than 16 years old. It has been known to cause seizures in some patients, and as well as neuropsychiatric events. So just be aware of that. You definitely don't want to be drinking alcohol while you're on this medication either. But yeah, this is all the smoking cessation agents that have an FDA approved indication for that. My name is Amber Gowana again, and I wish you the best in all of your studies.